everybody. I'm your host, Ari, and I've got a whopping 26 points to give away to one of our contestants that can prove that they are smarter than a fifth grader. Now, let me introduce to you my class from Concordia Elementary School. Awesome. So for our contestant that we're going to pick from the crowd today, Anareli.
Hi.
Alrighty, and you get to pick a fifth grader to compete against.
I would like to pick Tallah.
Perfect. Alrighty, Natalie, we're gonna swap you out real quick. Take your name tag with you or leave it, that's totally cool. Alrighty, so we have Anareli and Tallah competing against each other for today's episode. And there is a caveat. So each contestant is armed with a fidget, and this fidget is going to indicate that they are able to call on their classmate, Natalie, if they have any questions or if they're unable to answer a question throughout the course of the episode. So they just are going to raise this up, and if they do, Natalie will come in and assist for any questions, and then we are going to get rolling on the episode today. So for today's episode, we're going to be discussing rheumatoid arthritis, otherwise known as just RA. And then to give a general overview of RA, your immune system is your body's defense against germs, pathogens, and illnesses. Normally, it does a great job of protecting you when it is intact and working properly. However, in RA, also known as an autoimmune disease, the immune system gets a tad bit confused and begins attacking the lining of your joints by mistake. This attack causes inflammation shown as swelling and redness in the lining of the joints over time, and this persistent inflammation damages the joint tissue by infiltrating the synovium, leading to pain, stiffness, and sometimes deformities in the affected joints. To make matters worse, this inflammation can spread to other parts of the body like the lungs, the heart, and the eyes, resulting in systematic problems. The exact reason why the immune system starts attacking itself isn't completely understood, but genetics and environmental factors may play a role. Alrighty, everybody. So I'm going to start by asking some questions about rheumatoid arthritis, and then each contestant is going to write down their answer and then give it to me. Again, if they need to phone a friend, they will use their fidget, and we are going to get started. How are you feeling?
I'm feeling great.
Great.
I think I can beat her.
Okay, here we
see
go.
About that.
Awesome. So first question, rheumatoid arthritis decreases the risk of hardened or blocked arteries in the heart. True or false? Alrighty, everybody, what's your answer?
False. False.
Alrighty, there we go. That is true. So a tie for this one. Good to go. Alrighty, so the next question we have is chronic inflammation causes the small airways in the lungs to thicken. This causes a person to present with which of the following symptoms? A, thick sputum. B, upset stomach, dry mouth, diarrhea. C, shortness of breath, chronic dry cough and fatigue, or D, headache and dizziness. Alrighty, we're gonna start that timer. Alrighty, what are we thinking?
A. My answer is C, shortness of breath, chronic dry cough, and fatigue. It was A. I chose A.
Awesome, so our fifth grader has beat our contestant for this question, but that's not a problem because you can still get points eventually with further questions. Sounds good? Alrighty, so next question we have, rheumatoid arthritis causes the pleura around the heart and lungs to become inflamed. True or false? Start that timer. Alrighty, what are we thinking?
I think the answer is true.
Okay, there we go. So for RA, it can have systemic effects within the heart and lungs as a result of systemic inflammation. This can result in chest pain, discomfort, and difficulties breathing. So good job, everybody. Alrighty, so next question. Chronic inflammation associated with rheumatoid arthritis can cause what to form in the heart and lungs, not just in the joints? Alrighty, what are we thinking?
Nodules.
Okay.
Nodules.
Alrighty, both of those contestants got that right as well. These nodules can form not only in the joints, but in other parts of the body, including the heart and the lungs. These nodules might develop in the pleura or lung tissues, and these nodules are a collection of inflammatory cells and tissues that can exacerbate complications of rheumatoid arthritis. Alrighty, fifth question, everybody, we ready? Okay. So loss of bone density in persons with RA develop due to what? A, loss of appetite, B, chronic inflammation, C, impaired mobility, or D, doctor's visits.
I would like to phone a friend.
Alrighty, we have our first phone a friend, Natalie. Alrighty, so we're getting some assistance here. I'm gonna reset the timer. Chat about it if you need. Alrighty. What are we thinking?
So we think the answer is chronic inflammation.
Okay, and?
Chronic inflammation.
Alrighty, there we go. And then why do you think that is?
So since the inflammation is going on for so long, it causes the bones to reabsorb the nutrients like the calcium, and it makes them more susceptible to different diseases.
Alrighty, there we go. Perfect. Thank you so much, and we'll see you in a little bit. Alrighty. And then next up, we have what are the most common joints affected in individuals with RA? Fingers, A, B, wrists, C, knees, D, hips, or E, all of the above. Alrighty, what are we thinking?
I'm thinking it is E, all of the above.
Okay.
I think the same.
Okay, there we go. Points again for both our contenders. And then moving right along, we have which of the following best describes the pain associated with rheumatoid arthritis in joints? We have A, sharp and shooting, B, dull and aching, C, throbbing and intermittent, or D, burning and persistent. Alrighty, what are we thinking?
B, dull and aching.
Ooh, I said sharp and shooting.
Ooh, okay, well now we have some points possibly being deducted from our contestants. That's okay, we can earn them back. Our fifth graders rocking it today. So the pain associated with RA tends to be persistent and can vary in intensity and is noted as typically dull and aching. This type of pain will typically accompany inflammation, stiffness, and swelling in the affected joints. Alrighty, moving right along. When are RA symptoms the most present? A, in the morning upon waking, B, after rest, C, in the evening, or D, in the middle of the night?
Can I phone a friend again?
Of course. Natalie! Alright, I'm gonna reset that timer. Alrighty, what are we thinking?
So we came up with in the morning upon waking up.
Perfect, and then?
In the morning.
Alrighty, there we go. We have a tie again, and why do you think that is?
So when you're sleeping, you're not using your joints. So when you wake up, they're really stiff. And then as the day goes on, you're moving them around and all the fluids move.
Perfect, awesome, there we go. Thank you so much, Natalie. We'll see you soon. Alrighty, moving right along. Which symptoms often accompany joint pain and swelling in rheumatoid arthritis? A, dizziness, B, fatigue, C, nausea, or D, heightened appetite? Alrighty, what are we thinking?
I think it is A, dizziness.
Okay.
I said fatigue.
Good job. All right, the answer is fatigue. So point for our contestant, Anareli. Good job. Tallah, we can work on that, no problem. Alrighty, so fatigue is commonly associated and accompanies joint pain and swelling in rheumatoid arthritis. This can be quite significant and persistent for individuals with RA. Alrighty, and then what impact can rheumatoid arthritis have on individuals' mobility? A, improved flexibility and agility. B, no impact on movement or daily activity. C, decreased ability to move joints freely. And D, increased strength and endurance. Starting that timer. Alrighty, what are we thinking?
I think the answer is C, a decreased ability to move joints freely.
Okay.
I also think it is decreased ability to move joints freely.
Perfect. So RA can significantly decrease an individual's ability to move joints freely, impacting their mobility. It often leads to stiffness, swelling, and pain in the joints, which can restrict movement and make it challenging to perform daily activities of living. Moving right along, we have, besides joint-related symptoms, what other clinical manifestations might occur in individuals with rheumatoid arthritis? A, vision changes, B, hearing loss, C, dental problems, or D, digestive issues. Alrighty, what are we thinking?
I think possibly dental problems.
Okay.
Ooh, I said hearing loss.
Ooh, okay, so wrong across the board, totally not a problem. We are going to come back to that, and then moving right along, which of the following areas should be assessed to understand the impact of RA on joint health? A, skin texture and elasticity, B, lung capacity and respiratory rate, C, range of motion and function in the joints, and D, hair color and texture. Okay, what are we thinking?
I'm thinking C, range of motion.
Okay,
Range of motion.
perfect. Alrighty, we're already making up those points. So assessing the range of motion and functionality of the joints affected by RA is important in determining the extent of joint damage, stiffness, swelling, and the overall impact of the disease on the client's mobility and quality of life. Tracking these changes can help in management and monitoring of the progression of the disease. Alrighty. What part of the assessment is crucial to understanding the potential involvement of RA in organ systems besides the joints? A, neurological examination, B, cardiovascular assessment, C, gastrointestinal evaluation, and D, eye examination.
I would like to phone in, please.
Alrighty, we're phoning in our classmate, Natalie. Alrighty, resetting that timer for you. Give a little more time. Alrighty, what are we thinking?
I'm thinking because I got this wrong on the last one, it might be eye examination.
Okay.
We also came up with eye examination.
Yay, perfect. Alrighty, again, we're just building up those points. Awesome, y'all. Thank you so much. And then next question, which aspects of the head to toe assessment is important to monitor due to increased risk associated with RA? A, skin pigmentation changes, B, blood pressure fluctuations, C, bone density, or D, joint deformities and swelling. Alrighty, what are we thinking?
I'm thinking joint deformities and swelling.
Okay.
Well, since we've been talking a lot about joints, I will say the same exact thing.
Good job. So RA often leads to joint damage, deformities, and swelling due to ongoing inflammation and the autoimmune nature of the condition. Keeping a close eye on changes in joint appearance, function, and swelling helps in managing RA and prevents further joint damage. Alrighty, y'all, 2 more questions left. We are rocking through this. So what aspect of the assessment helps identify the impact of RA on a patient's daily activities? A, social history, B, dietary habits, C, functional assessment of activities of daily living, or D, sleep patterns.
I'd like to phone in again, please.
Gotta phone a friend, Natalie! Alrighty, resetting that timer. Alrighty, what are we thinking?
I'm thinking C, functional assessment and ADLs.
Way to go.
We also said C.
Okay, why is that?
So the functional assessment is to assess things that the person can do, like cooking and cleaning and just normal things. And depending on how limited they are, you will have to do things to adapt to stay independent.
Perfect. Thank you so much. Thank you. And then last question. I'm going to show an image to both of you, and then tell me which deformity associated with RA does the picture represent. Here's the picture. Alrighty. Counting my timer down. Alrighty, perfect. What are we thinking?
To me, that looks like swan neck.
Okay.
Same here.
Way to go. So this deformity involves the fingers, particularly the proximal interpharyngeal joint becoming hyperextended and the distal interpharyngeal joint becoming flexed or bent towards the palm, resulting in a swan neck appearance. So that is the last of our questions. Congratulations, Anareli. You are smarter than a 5th grader. Here are your 26 points.
Oh my god.
Thank you so much, everyone, for joining us today. We hope to see you next week on Are You Smarter Than a 5th Grader? Thanks, everyone. Bye.
Bye.